What is going on, everyone? Today, I wanted to talk a little bit about breathing patterns because it's important to recognize the differences when we're doing our patient care, assessing our patients. But also, like I noted in this video, it's also good when you're taking exams, like National Registry exam, right? Because you might get scenarios that they describe to you, and if you don't know the differences in the signs, symptoms of different breathing patterns, you can kind of get messed up a little bit, and then that's going to make it so that you end up sort of missing a question, which you don't want to do. All right, so I want to talk a little bit about it and kind of go over them, and I got a little pic I want to show you as well on it. But one thing you hear about, right, is Cheyne-Stokes. All right, and this is that period of we get that the deal where it's an abnormal pattern, that inspiration, expiration, and the breathing becomes progressively deeper, all right, and faster, and then it's followed by apnea. Okay, and this is one of the things that we see a lot in when we look at patients that might have overdose, uh, increased intracranial pressure, things like that. So the one thing I want to note though is that the next thing I want to talk about is the bias respiration. So don't get the two of them confused, all right? Because a lot of people get the two confused because they are in a lot of ways very similar. Okay, with bias is also this abnormal pattern of breathing where you get the deep respirations, but this is sort of groups of regular deep respirations and inspirations, and it's followed by uh, sort of irregular or regular periods of apnea. The difference is you got to think about with bias is more when you got patients who have an issue, by a stroke. Okay, they might have had a stroke or maybe some type of a trauma that affected the pons area of the brain. Okay, it can also be caused by opioid use as well. So it's very tricky there. This is why it's important to kind of identify the two different uh, causes there, right? Because they are very similar. We have Cheyne-Stokes with periods of inspiration um, and expiration, deep patterns with periods of apnea, and in bias is very similar, but it's sort of an irregular period of inspiration and expiration followed by the apnea. Okay, and again, the bias you see that a lot in trauma, things that affect the nervous system. All right, with Cheyne-Stokes, you'll see that more when you talk about things like overdose. All right, normal respirations, 12 to 20 breaths per minute, regular inspiration, expiration, right? Some people might say the rate's 12 to 16 is normal for an adult, but 12 to 20 is what the EMS national guidelines are saying right now. Bradypnea or bradypnea, okay, that's also regular, and you got to be careful you don't get that confused with bias or Cheyne-Stokes, right? But that's less than 12 breaths per minute. And then tachypnea, where they're breathing faster, it's regular. The breaths are breathing is a little shallower, and an increase of over 20 breaths per minute as well. And you'll see this a lot with like fever, patients really stressed out. Keep an eye on that with the fever. I know I posted things about sepsis and the breathing being part of the assessment deal when we talk about a patient having some sort of issue with breathing and sepsis. So tachypnea comes into play there. So keep that in mind, right? Apnea, like I mentioned before, a period of apnea when we talk about Cheyne-Stokes and bias, right? That is they're not breathing. It's a period of zero respirations. Okay, so when a patient is not breathing at all, you might say they're apneic. But when we talk about apnea, you're documenting that. You're going to be saying the patient's got periods of apnea, right? Hyperventilation. this is, again, this is anxiety, stress, a lot of exertion, even, patient really exercise. Okay. Um, this is where they're blowing off too much CO2, and this is causing a decreased level in their blood, right? So that's why they're breathing a little bit heavier. And then also keep in mind with when they end up sort of passing out, right? The whole giving the paper bag type thing to breathe into. Okay, some people put an RE breather on them, but they don't inflate the bag with oxygen to get them to sort of reset themselves. Now, I want to show this graphic to you to kind of share this a little bit. Guys, hit that like button for me too if you're finding this useful as I look for this picture here. Yeah, hit that like button for me. Let me know that this might be a little bit useful to you. Don't forget to go to myturbomed.com, sign up there, the free Insider member. It's a free membership, a bunch of more content you can use there, including some practice exams and the NRE Lite version of the NREMT sort of simulation software there. So let me try to find this picture. I want to show this to you here, but I want to talk about one other thing before I round out the day today. Let's see. Okay, here we go. So here's a picture of some of the stuff I've already talked about a little bit, but there's one thing here that is not mentioned. All right, and what do you think that is? Well, it's the Cosmol breathing. All right, a lot of times you'll see this with patients who are diabetic. They're in that DKA, that ketoacidosis, right? So they're in severe metabolic acidosis. You might see this in kidney failure as well. And this really is another sort of form of hyperventilation. But a lot of times when we get the patients in metabolic acidosis, depending on when we get them, when we see them, all right, the breathing at first can be rapid, shallow, but as the acidosis increases, meaning how long they've been that way, right, then the breathing becomes deeper. It becomes more labored, gasping. And this is when they refer to it as the Cosmol breathing. All right, now keep in mind, you get patients like this, right, because they have DKA or whatever, and we get upon a patient like this, they're going to need to be ventilated, all right, because when they get to that point where their compensation is going on and they're trying to compensate for that metabolic acidosis, when we get to them, they're having a much harder time when they get to the point where they have the breathing that's deep, and they're going to need to be assisted more than likely. Okay, in that case, all right. So just some things to keep in mind, because this is why you get patients with high sugar. You got to kind of keep an eye on them because you don't know at what point they might turn that. Thinking about their mental status and stuff like that. So all of that sort of ties in. This is why I want to kind of talk about this today, because I want to sort of point out these different patterns, because when it's good to know for the field, right? When you're out in the field, you're assessing patients, it's good to know these things, right? To piece it together as part of your overall assessment, attempts, right? But it's also great when you talk about taking an exam, whether it's the National Register or anything else, when they can't show you a video of a patient breathing. I know National Registry is thinking about doing stuff like that, right? But most exams, they're not going to show you a patient breathing in these different, patterns. So what they're going to do is describe it to you, and they're going to give you other clues that they overdosed, that they were in a trauma, that they're a diabetic. Okay, so when you see clues like that in your exam question, and they're also talking about the patient having regular episodes of deep labored breathing followed by periods of apnea, where they tell you the patient is maybe acidotic. Okay, they don't even mention the diabetic part of it. They just say the patient's in metabolic acidosis. Or they might say that a patient with Cosmol breathing is considered to have what type of metabolic problem going on. So it all ties in, all right? And I know that out in the field, we see these breathing patterns. And once you see these once or twice out in the field, it's going to click for you. You'll know in the future. But when you're sitting down in front of a computer screen or on paper and you're reading it, it's a little more tricky to piece it together. So just know the key points here, all right, in this little clip, or you can join me over at myturbomedic.com and you can see more content there about it as well. But this is going to help you piece together the key elements of information so that you can go ahead and understand what the question is asking and not give away easy questions. All right, guys, I'm going to end it there. I've gone over my 10 minutes. I've been doing that a lot lately. I don't know what's going on, but just keep this stuff in mind. I want you to go ahead and succeed. I want you to pass on your exams, and I want to try to make it easier for you. This is why I'm giving you this free membership at myturbomedic.com to give you a wealth more of information and resources you can use to be better at EMS. And of course, I encourage you to join me as a premium member at Turbomedic as well, because there's even more content in the premium section. But hopefully I see you in the free members area. I hope this helped. Like I said, hit that like button. Let me know that you get some value out of this video. And I really appreciate you popping in here and joining me live if you are watching live. And until next time, guys, as always, I am Jim Hoffman from EMS SEO. Stay safe.